You should be live.
Okay, thank you guys. I appreciate everybody joining this call today. I'm going to do a little bit to help set it up for everybody. Since this is the first of our regional report out calls for the Northeast region. This is a project endorsed by Governor Kelly and Speaker Reichman and Senate President Masterson as a bipartisan effort to make sure we're getting information out to people in the regions that they live in. There's ability to hear what's going on in Kansas. You can find your county data. The healthcare systems move regionally. And there's a map that was created by the Healthcare Coalition. It's a part of KDHE, the emergency management and others follow. And that's what we're following and how we divide it into these regions and as the healthcare systems tend to move. Like I said, this is the Northeast region, and which will be live every Tuesday at 2 o'clock. Giving you a snapshot of what's going on. The goal of these calls is to be informational, not prescriptive in the sense of encouraging anybody to tell what to do with the information. We just want to empower leaders regionally to have conversations based on the same data set. This week we have a dashboard created by the Hospital Association of Kansas, which we're grateful for. Next week, KDHE will have a regional dashboard, and we'll also be getting information from Mission Control, which is the software that's used in transfers between hospitals that will add even a little more color. The dashboards tell one story. The healthcare professionals on the ground in your region can add color to that and help translate it for anybody who's not in healthcare. But if you're an elected official and you have to make decisions based on what's going on in the pandemic in your region, or you're a business leader or community leader, or parent, or caring for the elderly population, we just wanted you to have the information up to date and know what's going on. So it'll be a snapshot on Mondays, but as you follow these, you'll be getting an idea of what the trends are and where the issues are in your region. All right. We won't be doing live Q&A. We don't have time for that. The goal is to keep these calls 15 to 25 minutes. This first one to go longer. And I appreciate all the presenters who did not have a lot of time to prepare for this as we asked them to volunteer on the fly. And we're kind of building this airplane as it goes, but we want to start getting information out sooner than later. You can sign up on an email list to follow these. It's covid.ks.gov/report-outs/. That's covid.kansas.gov/report-outs. And then for Q&A, we're not going to be have time for live Q&A, but we have ksregionalreport@gmail.com. If you send us your questions after today's call, we'll do our best to incorporate them into the next call. So that is ksregionalreport@gmail.com. Just tell us you're talking about the Northeast region, and we'll make sure we try and address it. The flow of these calls will start with public health. From testing and positivity rate, that data feeds into what's going on with our hospital systems, and we'll get an update from the hospitals and their dashboard, and then kind of a boots on the ground perspective. And so let me kick it over to public health first. We have Derek. How do I say that? Flurlage? Flurlog. So close. From Shawnee, that's going to give us a snapshot of what's going on from a public health perspective in your region. Thank you, Derek.
Yeah, John, I don't know if I can share my screen, if that's okay.
I think Megan can give you that ability here. And I want to thank the League of Kansas Municipalities who's handling all the tech on the back end of this to help set this up. It's Derek, I think you now have the ability to do that.
All right. I suppose I got a little fancy with it this week. I like PowerPoint, so we'll try it out. My name's Derek Flurlog. I'm the Infectious Disease Division Manager for Shawnee County. I'm a respiratory therapist by trade, have worked with a couple people on this call actually that I see, so it's good to see familiar faces again. I've been in this position since August, and prior to that, I was a director at a nursing home here. So a really unique, well-rounded, I think, kind of view on all of this pandemic that's really just been twists and turns. So we have a lot of testing sites around the region that have recently gone up, with a few of the counties within our region that are conducting some randomized testing, even in schools and among essential healthcare workers. We're not quite to that point yet here in Shawnee County. We've worked really hard on increasing our testing capacity, and we'll get to that here in just a moment. But we've definitely increased private providers here in Shawnee County. there's quite a few here in Topeka, and then a couple of outreaches in the corners as well. So we do have 3 new sites that are fully operational. I know these have been mentioned a couple of times, but this was KDHE's initiative through Well Health. We have a 4th site becoming available and operational on Friday. So that'll be at the Topeka Shawnee County Public Library. The other 3 are Hummer Sports Park, Topeka Housing Authority, and goodness, I'm blanking on the 3rd one. But you can go to gogettested.com/Kansas, and that'll help you find those sites. It actually uses the IP address of your computer or your phone to find what might be the closest to you at that point. So these are saliva PCR tests, and there's no prerequisites. So you don't have to be symptomatic or anything like that. They just suggest that you do an appointment at gogettested.com/Kansas, and that'll get you booked and ready. They are open from 9 to 5:30 due to some cold weather here in the last few days, and probably remaining cold. They've bumped the start time back to 10:30 and then closing a little early at 4:30. But I have actually been tested through one of these sites myself and came back negative, luckily, but was a cool
Derek,
operation.
Are the turnaround on the results, is that pretty quick on these?
Yeah, they usually say 48 to 72 hours. I believe their goal is 48 hours or less. Mine came right in that area. So, and it really just depends on how many tests they're turning around. We've had quite a few people go through those. I don't have updated numbers at this point, but quite a few people. I should mention that our testing capacity was about 2,500 people per day for just those sites. That's not including the private providers we have here in Topeka and here in Shawnee County. So the testing here also has increased at adult care homes. This was per the governor's EO 20-69, and this kind of matches requirements from CMS. And that'll include assisted livings, independent, and some intermediate services, mental health care, adult daycares, and that sort of thing. So really covering a broad spectrum of care in the county and around the state to kind of give us a better idea. Testing is the best way to, help stop that spread, to go along with all the other mitigation strategies that we have in place. Looking at our percent positivity regionally, I was able to get some rates from, these are all the counties in our region, and then on the far right there's a regional average. So that's pretty darn high, I won't lie there. Here in Shawnee, again, this is for this 12.6 to 12.12 range. Shawnee County, we were just a little bit below 15%, and we have been running as high as 20-21%, and the hospitals are seeing percent positivity rates much higher than that. But I would stress that for our rural counties that we have here in the northeast section of the state, a lot of them are really struggling with these higher numbers. They don't have quite the staff to handle those influx of cases. And we've offered technical assistance, I'll say, where we can, but it makes it a little bit difficult on them. And I'll kind of fly through these. These are, I just want to show some of the trends, John, the percent positivity rate that we've seen increase here. This is Shawnee County, just Shawnee County. Far left is March, and we've made it all the way to our 14-day rolling average last on November 29th. We were just about 20%. And then a snapshot of we're basically in the red in our region here. So I did my best to crop that out using KDHE's COVID-19 Kansas website. These are the age groups here. Again, just in Shawnee County, I'm only privy to that data at this point. Hopefully we get a better, well-rounded regional view as we go on with these calls. But we've seen that age group shift more towards the 25 to 44 age group. And then our COVID cases by month. This is really staggering for us. Even when we were hitting 794 and 593 in August and September, we just never imagined that we would do over 3,700 cases in 1 month. And December's number, again, we're halfway through, so we'll see what that ends up being. But 817 is still quite high as well. And then unfortunately, this comes with some deaths as well. These are our COVID-19 deaths by month. Currently, we're reporting 177 total to date. And then we had that really, really just sad spike in November. And I know our hospitals can speak to that and just the sadness that they've seen really affecting our healthcare workers, and keeping in mind that there's multiple family members for each one of these deaths. And that's something to consider too. I like to end on this. The first best time to take action was yesterday. The next best time is now. And courtesy of Craig Barnes here in Shawnee County, I like to promote our 3Ws: wash your hands, watch your distance, and wear your mask. Stop my screen share. That is what I had prepared for you.
Derek, thank you very much. I appreciate it. I'll pivot. That sets up, you can see what's going on with the positivity rate. You can see what's going on with the caseload and the deaths. Now let's pivot. Sarah, if you can take it away from the hospital perspective for us.
Sure. Thanks, John. So I'm Sarah Gideon. I'm with the Health Innovation Network of Kansas, and I'm joined by Dr. Kevin Dishman and Dr. Salah Najm from Stormont Vail Health. So they'll give a little bit of more of a boots on the ground perspective in a moment. I wanted to review a dashboard for our 23 county area in Kansas, and we'll just go over a couple of numbers briefly before turning it over to the doctors.
And this dashboard, just to interrupt you, sorry, this dashboard will be shared with the video too, so people can look at it. So
fantastic. Thank you.
Yep.
So we have had just shy of 3,000 new cases in the last 7 days in our 23 county area. About 30% of the hospitals in our Northeast Kansas region are indicating that they're going to have critical staffing issues. And so we talk about staff, stuff, and space. In our world, we need to have staff to be able to care for patients. We need to have patient beds, equipment, and PPE to do so safely. And we need to have the space within our facilities. Right now, the staffing issue is probably one of the bigger components. Although we are also seeing in some areas where things like oxygen tubing and certain sizes of surgical gowns and masks are becoming more of an issue to be able to obtain in our smaller hospitals. Our smaller hospitals are caring for patients longer with the assistance of hospitalists in our larger hospitals, and are sometimes having to transfer to hospitals that would be outside of their normal transfer patterns. So this can compound some of the issues that we're just seeing across the region. And our region oftentimes would also be affecting the Kansas City metro region, as patients may need to go there for higher levels of acuity in their care. I'm going to turn it over to Dr. Dishman, who is the Chief Medical Officer at Stormont Vail, and Dr. Najm, who is the Vice President of Acute Care Services, to give a little bit more insight from what they're seeing within that hospital in Topeka.
So we actually asked, yeah, please. Actually asked Dr. Najm to join us as an intensivist. He's probably got the best perspective for, I think, the information you're looking for.
Hey, hi everyone. My name is Salah Najm. I'm one of the ICU specialists here at Stormont Vail, and also the Vice President of Acute Care Services. So kind of what you guys discussed, the numbers have been going up and down, and mostly up for the last few weeks. Part of the difficulty with this disease is several parts. One is it is somewhat unpredictable. It's hard to predict and forecast exactly what the numbers will look like. But overall, it's been a general trend up. In the hospital, what Sarah mentioned, we've been very busy. Extremely busy. And there's two main factors to this. One of them is the actual virus. So once you catch the virus and you get sick from it, there's a percentage, not everyone, I mean, a lot of people are asymptomatic, but there's a good percentage that end up sick in the hospital. And then the second part is the complications that we see, either people 3, 4, 5 weeks or several weeks out of the illness, they're still sick and they still have a lot of new problems that develop from the virus. Pneumonias, infections, clotting, there's a lot of secondary problems that develop from the virus. And the combination of, so when we look at numbers for the coronavirus by itself, that's not fully representative of what we're seeing in the hospital. So we're actually busier than what the numbers look like sometimes. And this compounded on top of what we usually take care of, surgeries, post-operative patients, post-surgical patients, the usual illnesses that people get, colds or heart problems or strokes or different medical problems. So adding all of these together, we've been quite busy these past several months, and we almost over doubled our ICU capacity. So the ICUs are operating at almost double capacity. The biggest challenge is, as Sarah mentioned, being able to staff these extra beds and the sicker population that we're seeing, the higher acuity that we're seeing in the hospital. So this is a new challenge and a very difficult challenge. We have a lot of people that are sick, and trying to find a bed and being able to staff these beds and take care of these patients. There's been a lot of referrals in and out, and trying to capture all these patients and taking care of them. So this also puts a challenge on our hospital. So we've been operating at roughly 70 to 100 patients for the past month now. And so this is a very large number. When you're talking in a hospital at 300 to 400 bed capacity, and then you add on top of it 70 to 100 COVID positive patients, and then you add on top of it the secondary problems that they are developing, and then trying to take care of these patients and caring for them and trying to find appropriate placement after they recover, if they recover. So bed is a big challenge. Staffing is a big challenge. And lastly, I want to talk a bit more about the morale of our staff. And everyone's been working extremely hard. Everyone's been working beyond what we usually are used to in the ICUs, our nursing staff, our administration. Everyone has been working, I'm not going to say 150, not 200, maybe 300% their capacity. And people can function at high capacity for a while, but then stress and strain on the system that becomes overwhelming a bit. And we haven't honestly seen that break yet. We're just seeing the numbers going up, and we're still trying to pull people and trying to staff our beds from different staffing models. I'm not going to go into the details, but we have people, providers, nurse practitioners, nurses working extra shifts to try to staff these beds. So hopefully there is a light at the end of the tunnel. Our big hope is the vaccine. I'm getting vaccinated on Friday, and so we're pushing everyone to get vaccinated. I scheduled an appointment and going to get vaccinated. And the last thing I'll also mention is kind of what you mentioned in the graph, Derek. We're seeing younger and younger population. Initially when this started, and people were mostly under the impression or the feeling that it's mostly in the elderly population, the 70, 60-year-olds. Yes, it is. We see it in the elderly, but we're seeing younger and younger. A few weeks ago, we had a 12-year-old that was very sick on a ventilator. We're seeing 20 and 30-year-olds. And unfortunately, we had a 22-year-old that passed away from ARDS and the coronavirus. So we're seeing a younger and younger population in the hospital. And that also puts a lot of stress and strain on our hospital in just seeing younger people too getting sick and very sick from this virus. Thank you.
Thank you, Doctor. And it's Dr. Nam. Is that the right way to say that? Thank you. And Dr. Dishman, anything you'd like to add?
I would just add, thanks. I would just add that we're really focusing right now on how do we get our providers time off? How do they get away from the bedside and get a chance to refresh and be their best selves and be with their families and try to find time for themselves. We could not do this without the effort of the entire 23 county area, from Abilene to Hiawatha, Seneca to Burlington. I think what you're seeing is that all those facilities have stepped up. They're intensifying and enhancing their ability to care for sicker patients, which has facilitated us doing what we do. We've become a very large critical care institution now, and we're only able to sustain this effort through the fact that we're all working together and that we've leveraged the relationships that we've developed over the last 2 to 3 decades. And that's what's keeping all of us afloat right now, is the fact that we're talking, we're communicating every day, and really focusing on how do we help each other get through this. Whatever competitive battle lines there were before all this, they are gone. So we're just trying to work together to get through this, all of us together.
Thank you both. Yeah, Sarah, anything you'd like to add on top of that? I appreciate you bringing these two guests.
No, I just want to follow up with what Dr. Najim or Dr. Dishman said about as a region, we work hard to communicate with one another to try to provide the best care possible as close to home as what we can get for our patients and their family members. And I would guess that Dr. Najim, Dr. Dishman, and Derek would all agree with me in saying that following our public health guidelines are going to be the biggest way that all of us, anybody watching this, can impact change until we see the vaccination move out into our state and until we see this pandemic start to change course.
Right, thank you. Before I wrap it up, Derek, anything you'd like to add? Are you good?
Yeah, I just want to clarify on the testing sites because I did remember the other one. So Hummer Sports Park, Topeka Housing Authority, Shawnee County Public Library is coming online Friday, and then New Mount Zion Church here in town as well.
Thank you very much. Hey, this call will be weekly, every Tuesday at 2:00. It'll be broadcast live on YouTube. You can sign up to be sent the recording of this if you just want to listen to it on your own time. You also have access to the dashboards on both the website, which is covid.ks.gov/report-outs. Send your questions or comments to ksregionalreport@gmail.com. We'll try and work them into the next one. Just knowing the hard work the Dr. Najim and Dr. Dishman that you guys are doing and your teams are doing is inspiration to all of us. Derek, thanks for what you're doing. And Sarah, also. We're going to try and end each call with a bright spot. These are heavy calls, heavy data and news. And so I have one out of a group in Manhattan. And if any of you guys ever hear any and want to end a call with these, let me know. Feel free to send these into the email address also. But a group in Manhattan is repairing bicycles for low-income residents so they can access testing sites and other public services related to the pandemic. In addition to repairing the bikes for free, they are providing information about pandemic-related resources in the community to residents. So what we want to find, we all have a choice. We're powerless in a lot of ways against this pandemic. We have the ability to make some choices to keep our community safer. But I love when we're catching people leaning in and making a difference positively. That's the choice we each have every day to bring a little light into the situation. Dr. Najim, Dr. Dishman, thank you to you and your teams. I know that you guys are very busy and probably stepping away from important duties right now. So this is the Northeast region. And we'll have said there's 7 of these calls for the 7 regions, but this one will be 2:00 every Tuesday. Thank you again to the participants and to Governor Kelly and Speaker Reichman and Senate President Masterson for putting aside the partisanship and supporting something that gets the information out there to their regions so people can have the conversations that they need to have. So we appreciate everything we're doing. The theme we're hearing, I've heard it now on 3 calls, is the hospitals really are on the edge. They're dancing near it all the time right now. So flattening that curve and bringing it down is really important if we want to have the care that we expect and hope for and want to help them go the distance on this. So thank you guys for all this. Dr. Dishman, do you have something you want to add there? I saw you unmute yourself. Okay. Thank you all very much and have a good week, and we'll see you at the same time next week.